Now moving on to urinary bladder pathology, cystitis, again, like I said, typically going to be a female, going to be a young female, typically. Again, they're going to have the dysuria, pyuria. Again, E. coli is going to be a major organism. Oh, but I forgot to mention this before with acute pyelonephritis. Again, if it's a young sexually active female, what? Staph saprophyticus can be a cause. So very important that Staph saprophyticus can be a cause of cystitis and again lead to acute pyelonephritis. But again, like I said, if it's cystitis, what? No white cell cast, right? Remember, no white cell cast if it's cystitis. If you see white cell cast, it's got to be what? Acute pyelonephritis, okay? Very important. Now, also mentioned too, you can see here, cyclophosphamide can be a cause, so I would be aware of that. Sometimes they'll put that on the step as well. Now, as far as your bladder tumors, of course, the one they're going to like to ask you about is your TCC or transitional cell carcinoma of the bladder. Again, like I said, typically going to be an elderly patient with hematuria. That's going to be the key. So again, elderly patient, hematuria, it's either going to be TCC or what? RCC. So don't forget that. Things like smoking can be associated with it. Aniline dyes, benzoamines, those kind of things can be associated with it. Again, cyclophosphamide from your cystitis also can be associated with it as well. Now, however, also notice down here that you can get schistosomiasis can be associated with it too. Hematobium, remember, hematobium is in the bladder. Mansoni and japonicum involve the mesenteric veins, right? Don't forget that. Very important, as you see, is in Egypt. Classical history would be somebody step on a snail. Remember, snail's a vector, and again, gets in the foot and then travels and causes the infection in the bladder. But the key is, if a patient gets the infection in the bladder, they can get what? Squamous cell carcinoma of the bladder. So very important that schistosomiasis causes squamous cell carcinoma of the bladder because a normal cancer should be what? Transitional cell, okay? So be aware of that. Here actually is a picture showing you schistosomiasis, which I'm sure you were just so dying to see. I know you were just begging me to show you a picture. So here it is. Organism, you see there's one there, there's one there, and there's one there. But again, very important, squamous cell carcinoma of the bladder. That's what you remember. And the key is this. They actually get squamous metaplasia first, and then they go on and get the carcinoma, okay? Now, it's also very important to remember that when you get the tumor, like I said before, they're going to have the painless hematuria. They may also get this urinary signs like frequency, hesitancy, and that kind of thing. But what you want to remember is that number one, the tumor can grow as a papillary structure out into the lumen of the bladder. And sometimes you can see this with so-called what? Cystoscopy, which means look in the bladder, they can do a biopsy and show you the papillary structures, okay? If it grows that way, typically patients have a better prognosis. If it's a flat tumor or ulcerative and grows in the wall, patients typically have a worse prognosis. Why? Because it's more invasive. So if you're going to get cancer of the bladder, you want to get the papillary type that grows out into the lumen first and then goes into the wall. So that's very important to remember. Okay, so you can see here, it can be papillary. Okay, now, adenocarcinoma of the bladder can be seen with a thing called exstrophy of the bladder. Exstrophy means that the bladder actually is inside out at birth. So what happens is the bladder is outside the pelvis and the mucosal surface is exposed to the environment. So what happens? You get columnar or glandular metaplasia of the epithelium, and then later on in life that can lead to adenocarcinoma of the bladder. So I would be aware of that. Now the embryonal rhabdomyosarcoma, typically seen in young females, infants and children that are female involving the bladder. Okay. Oh, here we go. As far as your congenital abnormalities, is your exstrophy of the bladder I just mentioned, and very important that the exstrophy can lead to adenocarcinoma. Again, because of the metaplasia, and then eventually they get adenocarcinoma. So I would be aware of that. Now, as far as these miscellaneous bladder conditions, if they ask you about any of these, cystocele, maybe because it's involvement of middle-aged elderly females, may be one thing to be aware of. Acquired diverticuli, because of BPH, can be seen in elderly males. Now, a diverticulus means what? We're talking about an outpocketing of the bladder wall. Why? Because what happens is this. Because of the hyperplasia of the prostate, right, you're constricting the urethra, right? So what happens? The urine backs up into the bladder. But the bladder says, no, man, I've had enough of this urine. Let me get rid of it. So the bladder is trying to force all this urine out, okay? But what happens is, number one, you get this trabecular pattern of the muscular wall, you can see. And the second thing is, because of the increased pressure, the wall gets weak, you get these little outpocketings that can form in the bladder. So very important, the diverticuli, you think BPH and elderly males. All right, and that concludes our renal pathology. Thank you.